One of the things that we take a lot of pride in at Premier Foot and Ankle Centers is joint salvaging of joints that are arthritic or that are no longer bending the way they once used to bend or have become painful. The big toe joint is the most common joint that affects the majority of our patients. Range of motion of a big toe joint should typically be 30 to 40 degrees of upward movement, so that as you're walking, as you're taking a stride, and you take the next step, your joint will bend and you can move on with the next step. If that joint is not bending, people will start to compensate by walking maybe on the side of their foot, or even they're turning their foot outward because it's just too painful to bend that joint and to be active and functional the way you'd like to be. Sometimes what can happen to these joints, looking at an x-ray, is calcium and mineral content will begin to form at the top of the joint, and the typical bone spur will form just like a door stopper that you place in front of a door. Then the big toe can no longer swing up and down with that hinge movement because it's blocked by bony buildup. We like to try to clean that up and preserve your original anatomy so that afterwards you no longer have that accumulation of bone jamming the big toe, and yet you've preserved your original joint with your original cartilage. Even cartilage that is somewhat worn can often be salvaged rather than putting in an implant or a spacer or doing joint replacement. Here is a patient who's been a patient for 16 years who had the left big toe joint worked on at that time, 16 years ago. You can see there was a curved smile incision, as I like to call it. The smile incision heals and fades very nicely, and 16 years later is almost faded. But look at the nice, clean, smooth range of motion in this joint. Even when we load this patient's foot, as would happen with standing, there's still clean, smooth range of motion. Now fast forward to the right foot, which hasn't been worked on, which was once the good foot and is now beginning to show similar symptoms. You can start to see that the joint begins to bulge. It begins to lock up so that when the patient is standing, you literally cannot get even 5 degrees of upward movement with that joint. If we take pressure away and use a prescription orthotic to support this foot, we can still tweak and get a little bit of movement out of this joint, but all of this accumulation, as shown on the x-ray, will jam the joint. So this joint can be salvaged. We do not need to put in a joint replacement, especially for our younger patients that have many years of activity left. And the goal is to get a joint that is stiff like this, with pressure points and pain and shoe irritation to the nerve that runs through this area, to bend more smoothly, more cleanly, for better activity and range of motion. So if you'd like to preserve original equipment, original anatomy, and not necessarily have a joint replacement, many of these joints can be salvaged and improved for quality of life and activity.